Most new parents want to get their children health insurance as soon as possible. One Mid-State native is no exception.
But she found wanting it and actually getting it were two very different stories. As for our story about the issue, Seth Kaplan live with that tonight. Seth.
A big story, Dennis and Valerie, because it affects a lot more people than just the woman we met who now lives over in Altoona.
I grew up in Carlisle, though, born and raised. I'm a bubbler.
And a parent of two who relies on the Children's Health Insurance Program, or CHIP. Alex Hamilton's son, Connor, is 6.
When he was first born, how long did it take?
Maybe a few phone calls, tops.
But her daughter, Brooke,
She's coming up on a year old, which is hard to believe.
even harder to believe, still no CHIP coverage after all this time. Alex first called the Department of Human Services when Brooke was a few months old. The response then?
You were rejected because you didn't provide information. Even though I gave Chip everything, obviously. They said, no problem, we'll resubmit you.
Months went by. She called again.
They weren't even showing that they had any of my income information anymore. And I don't know if that had something to do with like the switchover.
A system switchover and a glitch with that switchover, which DHS acknowledges delayed a lot of other families' CHIP applications too.
So I had to completely reapply again.
She's the first to say she and her husband are relatively fortunate. They have good jobs and a really nice pediatrician's office.
They're being very patient with me. And honestly, they've been wonderful. But I mean, they are waiting to get paid almost a year now.
The Hamiltons can afford to buy medicine if they have to. Because of their income, they pay for CHIP, whereas some families get it for free.
I mean, these kids are going without healthcare coverage.
But not much longer, according to DHS. And the Hamiltons, after we started working on the story, we heard back from Alex, this time with her 2 assistants.
This is Connor. And this is Brooke,
who, like Connor, is finally about to have insurance based on what Alex just heard from DHS.
You know, I will say I appreciate the phone call back, and it really sounds like they're trying to do everything that they possibly can.
And look, little Brooke Hamilton might have slipped through the cracks no matter what Alex did. But DHS says one important tip is to always apply for every program you think you might qualify for. For example, Medicaid, even if you're not sure you qualify, because if you don't, DHS will usually refer you to a different program that might be able to help you.